McCarthy Robinson MN662. First, the question is discussing the client encounter and what therapy modality was used, and what the diagnosis was. So this client is a younger man, 38 years old. Just a little history about him. He tried to commit suicide on his motorcycle, hitting a wall head on. He's now quadriplegic. His diagnosis is borderline personality disorder. And he has, at times, gets frustrated and gets angry and kind of has a knee-jerk reaction to those that are around him. So talking with him, I just wanted to explore dialectical behavior therapy with him. I think it could be effective for him so that he doesn't just spot out mean things to peers or people are trying to just help him. So, I talked to him about it, and, I said, you're being mindful of how you're feeling, being mindful of those that are trying to help you, and understanding I was empathetic that he did say he's frustrated that he can't do a lot of the things that as he phrased it, normal people can do: toilet himself, walk, just putting his clothes on, things like that. Really frustrates him. So I asked him about that, and he just said it just really frustrates me, and sometimes I take it out on others. So I was appreciative that he was able to recognize that. So I wanted him to, I know I said to him, it's kind of cliche, he may take it that way, that just counting to 10 before he responds with his frustration and his anger. And he said he would try that. So having that emotional regulation will allow him to manage and change those intense emotions that are causing him problems in his life. The interpersonal effectiveness skills can equip him to navigate relationships more effectively. He tend to push others away because of how he responds. So I said, you can assert your needs and handle those conflicts by maybe just deep breathing exercises. Talk to him about that, or just the counting before he responds. So this therapy, I believe, not only addresses the symptoms associated with his bipolar disorder, or borderline personality disorder, but also a framework for building life worth living, emphasizing both acceptance and change strategies that are tailored to specific needs of him. Observing reality before reacting inappropriately. I told him is key, and to try that, and he said he would do that. The next bullet is consider a psychotherapy session with an adolescent or pediatric client for this similar reason. As the nurse therapist type, might begin the session by establishing that rapport, of course, with the adolescents, using age appropriate language and examples. Mindfulness exercises, as I discussed earlier, might also involve simple grounding techniques that can help the adolescent manage moments of emotional overwhelm. For distress tolerance, I could introduce activities like deep breathing, as I said, or a visualization, or the counting that I discussed earlier, which are effective yet straightforward for adolescents or pediatrics to understand and apply, so that emotional regulation in adolescents with the borderline personality disorder can be addressed by helping them identify and label their emotions, which is a skill often that requires development at this age. Teaching them to observe their feelings without immediate reaction can be pivotal. Interpersonal effectiveness would focus on sceneries typical of adolescents' lives, such as a peer conflict with a family member, assertiveness in school settings. It could help the adolescents or pediatric patient with, going role playing, give examples and have them role play with me so that they can know that this is a safe space and how they would, practice it before using it, in their daily life. So what are special considerations that are most important for this age group and population? Well, adolescents are in the critical development phase where identity formation and independence are key processes. As the therapist, I need to address these aspects while considering the typical developmental challenges of adolescence. It's important to recognize behaviors with the borderline personality disorder that might overlap or exacerbate by normal adolescent development, such as emotional volatility and identity exploration. So, involving the family in therapy is very beneficial. Can navigate, we need to navigate interactions carefully to maintain trust with the adolescent client. Peer relationships, so the social interactions are highly significant with adolescents, and therapy should address issues like peer pressure, bullying, and development of healthy friendships. Educational support, so coordination with the school personnel can be beneficial, which is as academic stress can significantly impact mental health. They may involve discussing accommodations that this adolescent may need, and knowing the needs of that adolescent. Crisis management. So adolescents with borderline personality disorder may be at a higher risk for impulsive behaviors, including self-harm, suicidal ideation. It's crucial to establish a clear crisis management plan, including safety protocols and emergency contacts. Engagement motivation, maintaining engagement in therapy can be challenging with the adolescents. Techniques need to be interactive and engaging, using modalities that resonate with younger individuals. And confidentiality and trust. While family involvement is important, therapists, must also maintain confidentiality to build trust with the adolescent client. Clear boundaries and agreements about what information is shared will need to be shared with parents or guardians. Meaning, with suicidal or homicidal ideations, then up front that if that's mentioned, that we have to share that. Do you see yourself working with this age group or population in the future? I always say I never will say never to anything. I may explore working with adolescents or pediatrics in the future, my clinical practice. I'm open to other opportunities, even though I have served primarily adult and geriatric population. So I would be open to that. Thank you.